It's with pleasure that I can introduce to you our panelists, and their names were on the slide that you just saw. They will be sharing their insights and experiences and some of the lessons learned, some painful, hopefully some not so painful lessons learned, and they'll be able to answer the questions that you have. So I'm going to ask each person to introduce themselves, and I'm going to start with Joel from Northwestern Medical Center. Oh, Joel, I think you're on mute.
The one thing I had to remember. I apologize. Thank you, Terry, for the introduction. My name is Joel Benware. I'm the Chief Operating Officer and Chief Compliance Officer at Northwestern Medical Center. That's a role I've had since November. Prior to that, I was the Chief Information Officer at Northwestern for about 7 years. And we were an early adopter on Expanse. We went live with the ED and the acute in 2017. And on the ambulatory, we went live May 2019.
Thanks, Joel. Jeanette, if you'd like to introduce yourself.
Great. Good afternoon, everyone. Thanks so much for the opportunity. My name's Jeanette Curry, and I am the Chief Information Officer for the Beth Israel Deaconess Community Hospitals, now a member of Beth Israel Lahey Health. So comprised of 3 community hospitals, one in Needham, Massachusetts, Milton, Massachusetts, and Plymouth, Massachusetts. We are just about to celebrate our 2-year birthday of our Expanse Go Live. We went beginning of the fiscal year back on 10/1 of 2018, and we're about to embark, that's full suite in terms of our inpatient and acute setting, and we're about to embark on our first Go Live in the ambulatory space in a few short weeks.
Thank you, Jeanette. And Mike?
My name is Mike Ward. I'm the CIO for Anderson Healthcare. We're located about 15 miles from St. Louis, Missouri, and we've recently upgraded from client server to Expanse in November of 2019, so we're about 10 months into this now. And we are live with ambulatory and converted from next-gen in our ambulatory practices to CPSI in our community critical access hospital, that is, and some other ancillary systems we brought together under one system.
Thank you, Mike. Jim?
I'm Jim Fitzgerald. I'm the EVP of Strategy and one of the founders of Cloudwave. Today in time, about, I want to get the number right, but I think about 80 of the hospitals that we host are running Expanse. We've helped those 80 implement it in cloud. We've probably helped close to another 100 implement it on premises. And we're happy to share whatever lessons learned that we can.
Thank you, Jim. Glenn?
Good afternoon. I'm Glenn DeBate. I'm the founder and president of Acmeware Incorporated for the past 22 years, working, as Terry mentioned, in the MEDITECH space. And prior to that, I worked at MEDITECH for 13 years, led the development of the data repository group, and I've had the pleasure of working with all the other panelists on this over the last number of years, in some capacity with the Expanse conversions. And we're very, very happy to have them here with us. So thank you.
Great, thank you. So this is our panel, and to kick things off, I just wanted to give a little statistic. I just reached out to my contact at MEDITECH because I was wondering how many hospitals are there right now, or what percentage of hospitals are on Expanse versus legacy platforms. And I learned that it's almost 30% of MEDITECH customers are on Expanse. It's a little bit higher or lower percentage in terms of hospitals, but about 30% of MEDITECH customers are live with Expanse or have licensed Expanse. And then 70% are still legacy. So that's why, I think a panel like this is still particularly relevant, because there are a number of hospitals that have not yet started the conversion or are thinking about it.